Good morning, everyone. How are you all? It's been so long since I last talked to you. This twice a week update seem to take so long to come round. I hope you're all doing well, and I hope everything is fine with you. There's so much to update you on, so much to update you on. So it's basically trying to choose what to discuss and what not to discuss. And maybe what we will do is then just good morning. I think maybe what we'll do is just put the rest of the updates on the page, because there's just so much to talk about that I have to choose specific topics. And if you have any topics that you want us to discuss, then pop it in the comment box. But there's so much. First of all, it's Mental Health Awareness Week, and I'm big on mental health. I feel like, if you're well in your mind, you'll be well in your body. So it's Mental Health Awareness Week, and the theme is kindness. So let's just go out there, look online. There are so many resources about mental health, looking after your own mental health, looking at things like anxiety and depression. Some people hear voices, some people don't sleep very well, some people have burnout, some people have delusions. I mean, you just need to look on Facebook and you can identify people with different mental health problems. I mean, we are all on the mental health spectrum anyway, so all of us are in a fine balance. And it doesn't take that much to take people off from what appears to be acceptable and normal to what is completely bizarre. So nobody is exempt from suffering from mental health problems. Nobody is exempt. So that's why we take so much care in looking after our mental health. And what I would say is that the kindness theme is so crucial this year, because there have been so many, when I look at online attacks on people's personality and abuse and trolling and bullying, it's no wonder that people are struggling with their mental health. So we're going to try and be kind to people, ongoing in our life. So Mental Health Awareness Week goes from the 18th of May, which is today, till the 24th of May. And we just share something on mental health, hopefully on the page daily, just some articles and different things. Good morning, Bissy. So mental health is mental health this week. And let's just watch out, not just for our own, but for our friends and our children. Our children are very crucial, because we normally think that they're okay, but they're at home. This has never happened in their lifetime. Not being able to see their friends, not being able to go to school. Many of them are very anxious about coronavirus. It's so let's just encourage each other and be kind to each other, and try and support one another. So it's Mental Health Awareness Week. Share the word. Where do we start from? There's so many updates, but the ones that really caught my attention are things about Madagascar. I don't know if you've all heard about Madagascar and all the different things going on in Madagascar, and Brazil. Those two countries have really stood out, in the last couple of weeks, as to the, sad on Brazil's part, and sometimes funny on the part of Madagascar. So maybe we'll talk about Madagascar first, because it's funny, actually. To a certain, well, it's funny, kind of. So Madagascar, as you know, have hardly had any problems with coronavirus. And actually, they only had their first death on the 16th of May. Despite all of this, despite the fact that Madagascar and Nigeria kind of started on the same level, and other countries, but Madagascar didn't suffer any deaths. There's 27 million people in Madagascar, and I think they had their first case, no, actually in March. They had their first three cases on March 20th, so they started a bit later than the others. And up until May, I think in total, they only have about 200 or so cases and only one death. Now, what the president quickly released was something called COVID Organic. I don't know if anybody has heard about COVID Organic. COVID Organic is like a juice or a drink that the government said that will prevent coronavirus and will cure it within 7 days if people get it. They got it, they bottled it, they started to send it to everybody and ask everyone to take it. If you refuse to take it, like the students that refuse to take it will be expelled from school, and they had very little testing. Now, the debate is this. I mean, being African myself, and my debate is, wait, do we have to follow the Western way of doing things? Or do we go the African way, which is very, very little testing, very little evidence, although it was developed by the Madagascar Institute of Applied Research. And you can see many governments knocking it and saying, oh, there's no evidence it works, it can be dangerous. This COVID organic is made from something called sweet wormwood or artemisia. I'm sure you've all heard of artemisinin, which is in some medicines actually. Artemisinin is also used for malaria. But so it's made from that, and they put a whole lot of other herbs in it, and it's been lauded to work. I mean, what do you think? You know, because sometimes I worry about being too westernized myself and being so focused on data and trials and testing that sometimes we forget the old way or our grandfathers are, you know, and the way that they were, the way that they treated themselves. However, the lifespan was very short. People were living to their 30s. So I think I'll still err on the side of caution and stay with evidence. So anyway, there's not really much evidence. There was a trial on 20 volunteers for 1 week. That cannot be enough. But despite that, they are doing very, very well. Although that island too gets some really strange illnesses. So what do we believe? What do we believe about Madagascar? Please, I don't know about COVID organic, but some other presidents, some other countries are actually going around getting them to ship COVID organic to their countries for them to take. If you had COVID organic, would you take it? You know, it's an interesting one. We can't laugh at, you know, at our way of reasoning, because there's no one way that is right, and we have to start to respect our own culture and the way we do things. So COVID organic, Madagascar is doing very well. Is that the right way to go? Yes or no? I don't know. I don't know, to be honest, but it'd be nice to see what is inside it and test it in the lab, look at the data and try it on sick patients. Maybe try it in Brazil, which is on the other end of the scale, because definitely if they ship it to Brazil and it helps them, then we know that COVID organic works. So what's going on in Brazil? Brazil is a very, very sad case, really. Brazil has gone from having, I think, only one case on the 25th of February to now being the 6th highest in the world. The government is crying, they are crashing, the health system is at breaking point because they are just having so many deaths. And I think it's now about 16,000 deaths or more in Brazil. Then I look at the trajectory of all the other countries, including the United Kingdom. We've all gone through that same trajectory of having very, very little cases, you know, not many. And then all of a sudden, it starts to exponentially increase until it peaks. So maybe Brazil is just following the same trajectory that many countries have followed. And this is what they have to sort of deal with. Like America is dealing with, like the United Kingdom is dealing with. But Nigeria has been a bit different. So in Brazil now, yeah, they've had over 16,000 deaths, as I said before. A lot of their presidential team have been infected. But Nigeria is another interesting case at Nigeria. So on the 17th of April in Nigeria, we had 493 cases on the 17th of April. Now, fast forward to the 17th of May, and we have almost 6,000 cases. There were 17 deaths on the 17th of April, and now it's 182 deaths. Again, it looks like it's really increased, but if you compare it with other countries, it hasn't. So are we testing right? What are we doing right? The economy has eased a little bit. They are still not allowing commercial flights in, and in fact, Nigeria impounded a British flight, a private plane who was bringing up, I guess, private citizens in for using, you know, for bringing in commercial flights. So it looks like Nigeria is also doing something right, although people on the ground might not generally agree because of the lack of social distancing in many places. But on a grand scale, sort of shutting the borders, not allowing flights in, not allowing flights out unless it's absolutely necessary, I think it's worked. Cases have gone up, but I still think it doesn't look like there's a massive epidemic going on in Nigeria based on the data that we're receiving. So yeah, that's a lot. There's so much to catch up on, as I said to you. I'll talk about quickly about the United Kingdom, and then we'll end it there. But please like, share, follow. You know, just share the videos. We've got to a couple of 250 likes now, so we want to increase that. So in the United Kingdom, what's going on? So much again is going on. You know, I like the idea that we're all trying different things. The number of deaths up until yesterday was 100 per 24 hours, so 170. I mean, it's awful that 170 lives were lost in a 24-hour period. However, is the lowest number of deaths we've had for over 6 weeks. So we are looking up, and we hope that things will continue to improve. And again, our hearts go out to everyone who's lost anyone during this time. It's awful. One person shouldn't die, not to talk about 170, but it does look scientifically like the pandemic is all going down. New cases are going down, deaths are going down, and 170 is good. However, it's the weekend, and what we normally see is that by Tuesday, Wednesday, the total number of cases go up. So that was good. Another interesting thing is that they're trying the medical dogs now, so to help to sniff out coronavirus and be able to find out if people have coronavirus, which is very innovative and it's very good. So that's something to look out for. The app is going to be in June. Schools are going to reopen. All of these things are being put in place. Train stations are filling up. Life is going to go back to normal. This will pass. Somebody was saying to me the other day that, will this ever be over? How are we going to live? I said, well, this was the same thing that was said during the Spanish flu and all the other pandemics that we've had. Life will go back to normal, and in 5 years' time, I might be looking back and say, that time of coronavirus, we all have moved on from it. But while we are in it, we have to follow the rules that have been set for us, which is social distancing rules. You can see somebody from another household, I think now, and you have to wear face covering if you're inside, if you're in a covered environment. So don't forget that we have to all do that, and carry on washing our hands frequently, and just carry on staying safe, just staying as safe as we can. So I really enjoyed it. This is quite a bit of a longer one, but I think we needed this time to really talk about the different things that are happening. So let's carry on sharing. Please send your questions. Now I'm going to be on the ball with the questions. Send your questions either on my personal page or Ask Vine Health on the Vine Health page. Join the Vine Health Champions. Like, share, follow. We are at, I think we're over 300 follows now and 260 or so likes. Let's try and get that number up. Let's come together and improve the health of ourselves and the community. And let me know what we want us to talk about going forward. One of the things I was thinking was maybe to come and break down health topics, things like diabetes, and really go into it and talk about it, or hypertension. But sometimes I feel like everybody knows about those things anyway, and you don't want to be patronizing. So please, if you want us to go into individual health topics, let's talk about that. I'm more than happy to share whatever I know, and let's just try and improve our health. We are all responsible for health. We are all responsible. So let's do it together. I don't have the complete fountain of knowledge. We all are sort of sharing. There are things I don't know that you know. So please, let's share it. But thank you guys. Have a fantastic Monday. Have a fantastic week. Remember that it's Mental Health Awareness Week. Talk about mental health to somebody today. Nothing to be embarrassed about. Please do talk about it to somebody. Support someone. Give somebody a call. Give somebody virtual hugs. And let's all just try and be kind to one another. And have a great week. Talk to you on Friday.